Hi, I'm Dr. Milescu. I am adjunct professor at Daytona State College, teaching anatomy and physiology lab as well as human biology. I'm here today to go over the axial skeletal system, all the bony landmarks. We're going to start with the skull. We'll work our way down to the vertebrae and the ribs, and that's all we're going to stick with in this video. There's a lot more to come. As you know, there are 206 bones, and we're going to go over all of them and all of the bony landmarks before week 8. We are now week 6, so the heat is on. A lot to learn, so let's get started. All right, so voila, this is a skull, and here is the lower jaw, the mandible. I detached it because I want to go over all the bony landmarks in the skull first. So let's begin without further ado. The front part over here, your forehead, this whole section, and it's labeled here, this whole entire section is called the frontal bone. Now you can see these sutures by 1 year. When the infant is a year old, this completely is fused. But as you all know, a baby, when it's born, has a soft spot, and the anterior fontanelle is right there. Eventually it fuses, and it becomes this whole big suture here. And it is an immobile joint, relatively immobile, and it's called the coronal suture, all right, because it looks like a crown. All right, so that is the coronal suture. Now, as we look at the top of the head, this whole section right here, this is called the parietal bone. So here's the skull. Look at the top of the head, and you can see this whole section is the parietal bone. Now, the parietal bone is divided by a suture that cuts across the sagittal plane. Okay, that's the sagittal plane. So, guess what we call it? We call it the sagittal suture. So this is the sagittal suture. All right, so frontal bone, parietal bone divided in half by the sagittal suture. Okay, now I'm going to shift and turn the skull posterior. You could still see here the sagittal suture. And then back here, the back of your head, this whole section is called the occipital bone. Occipital bone. Now, you see here, this is a suture. It meets up with the sagittal. This is called the lambdoidal suture. Lamb as in the animal, L-A-M-B-D-O-I-D-A-L. Okay, so lambdoidal or lambdoid suture. And there's your occipital region. Okay, that's the whole occipital bone. Parietal bone, that's the whole parietal region of the brain inside. Okay, but this is the parietal bone. And then in the front, frontal bone. Okay, so that's pretty easy. Now let's go to the profile view, lateral view of the skull. And if you look closer, I don't know if you see in the video, but one of my students, actually quite a few students, were very diligent and labeled all the parts of the bone. So this whole section right in here, that's the temporal bone, as you can see, the temporal bone. All right, now just anterior to it, that smaller section, I don't know if you can see the wording here, but that is called the sphenoid bone. And there's a suture that separates it from the rest of the region. Okay, so that's the sphenoid bone, temporal bone. Now, there's one more suture to learn. You learned about the lambdoid, right? Now follow over here. Do you see another suture? That suture is called the squamous or squamous, however you want to pronounce it. Squamous suture, and it delineates a separation between the temporal and guess what this is? As we learned previously a few minutes ago, that's the parietal bone. So parietal bone, frontal bone, occipital bone, temporal bone, and sphenoid bone. And here are the sutures: coronal, sagittal, okay, lambdoid, and squamous. All right, now take a look at this whole section. I'm going to bring it really close to the video. This is part of the zygomatic bone. So this is your cheekbone. All right, so the zygomatic bone, you can see there's another suture there that delineates the zygomatic bone. Now there's another suture here. You probably don't know, you don't need to know all the specific detail of this, but I'm going to show it to you anyway so you can understand, if you see it in a book, why it's named the way it is. So this is kind of like a bridge from one bone to another. So this bridge here is basically going to be named upon what it attaches to. So we call this the zygomatic arch. But because it's the temporal bone and it attaches to that zygomatic bone, we call this the zygomatic process of the temporal bone, because this is still part, see the suture right there? This aspect, this little piece of bone right here, it's still part of the temporal bone. But because it's attached to the zygomatic bone, based on that suture there, we call it the zygomatic process of the temporal bone. Now when you look over here, if I bring it real close, this is still part of the zygomatic bone. But because it attaches to the temporal bone, which is right here, we call it the temporal process of the zygomatic bone. So that can get a little confusing. I doubt that we're going to ask you that on the practical, but just make sure you know that that's the sphenoid, that's a temporal bone, okay? Your zygomatic arch, your zygomatic bone, that's definite, okay? All right, so now let's look at the front of your skull. All right, so right here, that's the bridge of your nose. You can feel it's still bony, but as you wiggle your nose, the rest of it is cartilage. So the bony prominence of your nose, the bridge of your nose, is called the nasal. So that's not too hard. Nasal bone. Now, do you see there's a separation between the right and the left nostril? Take a look. Okay, so it goes straight down, and so it's a piece of bone that goes straight down. So because it goes straight down and it's perpendicular to the maxilla bone, which is right here, so this whole section that holds your top teeth, this is all the maxilla bone. You see the delineation? There's a suture there, and then there's a suture there. So this whole section right here is the maxilla bone. This is why when we do dental work and you have pain, it can go all the way up to the eye, because it reaches the inferior portion of your orbit, which is basically your eye socket. So a portion of your orbit is still part of the maxilla bone. That's why you have so much pain that radiates, plus all the nerves. The facial nerve and trigeminal nerve have many, many branches, which we'll go over when we do nervous system. All right, so let's continue. So that piece of bone that's straight down is called the perpendicular plate. But then if you look in profile, I don't know if you see, it slopes down like a ski slope. So back there, it's straight. So back there posteriorly, it's called the perpendicular plate. Right there. And let me put my light on it so you can see if I can do this. Right in there. So that is the perpendicular plate right back there. You see it? Okay. And now as you slope down at the bottom inferiorly, right there, it's called the vomer. So down here, inferiorly as it slopes down and out, straight out, that's called the vomer. You could also see the vomer if we turn the skull upside down, and of course this is labeled. If I take this label off, here we go, voila, that is your vomer. Do you see? Right there is your vomer. Okay, so I'm going to put the sticker back on for the students. That is your vomer down there. There it is, okay? All right, so let's return back to upside. There it is. And I want to continue with the nose, because the nose knows. And you're going to know a lot about the nose, right? So we have the perpendicular plate, and down here it's the vomer. Now, it kind of looks like shelving units. Do you see those little bumps on the side right there? One there, and then it's all along the lateral walls. Okay, one here. So there's supposed to be a superior, middle, and inferior concha. That's what we call it, C-O-N-C-H-A. Unfortunately, in this skull, all you can see is an inferior and a superior, right there and there. Okay, so I'm going to use the light to show you. So right there and up there, right there and there. So that's the superior and inferior. Obviously superior is above and inferior is below. Okay, so that's that, everything you need to know about the nose. Now a little bit more challenging with this video, if I can get this going and you can see everything, is the bones around the orbit. And I have a great mnemonic and I'm going to go over it and teach it to you so you'll never forget. All right, so up here in the front, do you see that there's a hole? So, you know, your lacrimal duct is there. That's where your tears are coming from. You see that little hole? So that whole section is delineated. Do you see there's a suture? So that little section right there where my finger is, okay, that is the lacrimal bone. Lacrimal bone. Now posterior to it, do you see a rectangle? So I'm going to try to shed light on it, if I can do this, right there. Okay, so do you see that? It's just posterior to the it's called the ethmoid bone, posterior to the lacrimal. So there's the lacrimal bone right there. I just have the light on it. And then posterior to it right there, that is the ethmoid bone. So I put these names together as a mnemonic so you can remember. Lacrimal stands for Lucy, and next to Lucy is her best friend, Ethel. So that's Ethel. Now watch in the back here. I don't know if you can see this, and you have to kind of use your imagination. But there's two slits. There's a slit there, and then there's a slit down there. So, and then there's also a little circle there. If you look real close, it kind of looks like a bird. I know it's a far-fetched imagination, but the body could be considered that lower slit, and then the upper slit there is the wing, and the head is that circle. Nonetheless, let me name what those are, those structures. So you have an opening, and let me point it to you. It's a little more difficult with the light and showing it in this video, but right, let me turn it properly. There we go. I have the light right on it. So there's the light right on it. And that little circle, okay, that's where, and I got my finger right below it. You see the circle? Okay, that's a canal. So large openings are called foramen. Deep and smaller circles or openings in bone is called canals. So this is the optic canal. Your optic nerve that's attached to your eyeball, okay? It comes out posteriorly and enters that canal and crosses over to the opposite side, crosses over. You're going to learn that in nervous system. But anyway, that's the optic canal. Now, the superior slit there, okay, that's called the superior orbital fissure. I have my finger right below it, superior orbital fissure. I am going to point the pen light on it. I don't know if you can see it. Let's see. There it is. Okay, so right there, superior orbital fissure. Now, if there's a superior, there's an inferior. So now I'm going to show you the inferior. So the superior is over here. It's posterior and medial. And then inferior and lateral is going to be the inferior orbital fissure, and there's my light directly on it, okay, right there, okay? So superior orbital fissure, inferior orbital fissure, and the head of that bird is going to be the optic canal. That whole section there, and if you're looking at Lucy and Ethel, if you're going on, this is the right eye, you're going counterclockwise, the whole superior rim of that bone, which includes the wing, superior orbital fissure and inferior orbital fissure, that whole section where my finger's at, that would be the sphenoid bone, Sam. So we've got Lucy, Ethel, and then Sam back here posteriorly. All right, then we move to the lateral portion of the orbit or eye socket. The lateral portion of the eye socket. Let's take a look. You see where my finger is? Guess what? It's on the zygomatic bone because the zygomatic bone ends over here. You see that suture? This is all the maxilla bone. But this right here, that's your cheekbone, the zygomatic bone. If you follow my finger, boom, that's the lateral border of that whole entire orbit. Okay, so the lateral border includes the zygomatic bone. So that's called Zach. So far we have Lucy, Ethel, Sam, Zach, and then the easiest one, if you follow this whole thing right here, there's the suture, this whole section of bone is called the maxilla. So the maxilla, if you look down in the inferior portion of the orbit, there it is, inferior portion of the orbit, all right, the eye socket. That's all part of the maxilla. And then we get right back to the lacrimal. So going in a circle, most medial, I'm going to take my glasses off so you can see. Most medial is going to be the lacrimal. Then around 10, 11 o'clock, it's going to be Ethel. And then noon to 2 o'clock, if you're looking at a clock, this whole section of the orbit is going to be the sphenoid bone, okay? The superior portion. The lateral portion is going to be, guess what? The zygomatic bone, or Zach. And then the inferior portion is going to be part of the maxilla bone. All right, so that's everything in the front. All right, now let's take a look at the lateral aspect of the skull. We talked about the zygomatic arch already. The other structures that we should go over, and it's on your handout for your practical, is going to be part of the temporal bone. So the structures that are part of the temporal bone, here we go. This sticks out. That prominence is called the mastoid process. And there's quite a number of muscles, including one of the main strap-like muscles that helps you turn your head, the sternocleidomastoid. And it even has the name mastoid in it. So the SCM muscle has an attachment here. So that's the mastoid process. Look how pointy it is, all right? But it's also very thick and wide. Now, another pointy prominence, okay, and let's show you both sides. You see, that's the mastoid process. Now, if you look at the mastoid process right there, just anterior and medial to the mastoid process right there, this process, okay, is pointy and more narrow than the wider mastoid process. So therefore, this is the mastoid process, and anterior and medial to it, if you turn it upside down, you can see that it's more medial, okay, because that's the midline. There's the mastoid process. And anterior is this direction, right? So anterior and medial, and boom, right there. That's your styloid process, okay? So take a look at the styloid process. Make sure you see how pointy it is. Styloid process versus mastoid process. And then take a look at that very large hole. So we call that the external acoustic meatus. So this is part of your ear. So let me shine the light on it. There it is. Okay, so hopefully you can see that's called the external acoustic meatus. So don't use lay terminology, not ear hole, ear canal. No, it's called external acoustic meatus. External acoustic meatus. All right, so all those three structures you need to know for the practical. The mastoid process, the styloid process, and the external acoustic meatus, all part of this whole temporal bone. This here is already the zygomatic bone, and don't forget this section here is the sphenoid, little small section, and don't forget the sphenoid is also posterior and superior back here in the orbit, okay? All right, now I'm gonna take the top off and take a look, take the top off, and I'm gonna take a look inside. Okay, so we talked about the sphenoid bone, that we saw it, where do we see it? We saw it here, and we saw it here, right? Superior portion of the orbit. We can also see the sphenoid as a structure that kind of resembles a bat in your head. So this is the body. These are the wings. That's the body. So take a look at that. See, that looks like a bat in there, all right? And look, see, you can see the body and the face, and then these are the wings. Bottom line, what you need to know is this whole section here is called the sphenoid bone. this whole section here is called the ethmoid bone, and we learned that ethel or ethmoid was right behind, so it's right here. It's right posterior behind the lacrimal bone. So lacrimal bone, ethmoid bone, ethmoid bone. All right, so now let's go over the structures that you need to know in the sphenoid bone, the bat. All right, so in the sphenoid bone on your list is sella turcica, optic canal, which we already learned, greater wing, and lesser wing. So let's go over all of that. So the first thing we're going to go over is sella turcica. So the body of the bat right there, I'm going to point to it. See right in there? Okay, that is the sella turcica. It almost looks like a little ditch. So inside this ditch, right there, inside the ditch, that is called sella turcica. Right in there, sella turcica, S-E-L-L-A, turcica, T-U-R-C-I-C-A, sella turcica. Now, you see the wings? Everything here, see that expansion right there? That's the lesser wing. The greater wing is inferior to it. So that's the greater wing, and then on top is the lesser wing. Okay, so lesser wing right there, and then underneath is greater wing. Okay, so sella turcica, lesser wing, greater wing. All right, so those are the structures regarding the sphenoid bone. Now let's take a look at the ethmoid bone. The ethmoid bone you can see outlined over here. You see the suture, so this whole section right there, that's all ethmoid bone. Now within the ethmoid bone, I'm going to bring it really close up in this video. You can see this whole section, there's a suture all around it, okay? And I don't know if you can tell, probably not with this video, but there are little tiny holes down here, and those little tiny holes allow the olfactory nerve fibers to move through and enter through the skull so that you can smell. So that's the cribiform plate, that's what that's called. Now if you take a look and you can feel this whole little ridge, it looks like a mountain, and probably you can't see the number. I can't read it. It's really tiny, but that right there, it's like a little tiny ridge. Hopefully you can see the ridge right there. I'm gonna shine my light on it. There it is, that ridge right there. See it? And that is called the crista galli. Crista galli. And the crista galli, what do I want to say about it? How do you spell it? C-R-I-S-T-A, so crista without the H, galli, G-A-L-L-I. Okay, so right there, that's the crista galli. I have my nail right on it. Okay, it feels like a little ridge. And then the base of that ridge is the cribiform plate. All right, so that's that. Now I want to go over the optic canal in a little bit more detail. As you know, when I went over the orbit and you saw the little bird in the head, there's the wing, the superior orbital fissure there. Then there's the inferior orbital fissure. Now back there, you could see that circle. That's the optic canal. So what I'm going to do is, I really can't fit anything in there, but I'm going to pretend I can fit it in there so you can see where it's going. Okay, so I don't know if that helps you any. Whoops. I'm going to try that again. Here we go. There. Okay, so that's your optic canal. And it's, you could, if it fit through, you would probably, there it goes, it fit through. And you can see that as it enters, take a look, it's going to eventually cross over. So if it enters the left eye, in this case, it's the person's left eye. Always remember, I'm mirroring, so you're looking at it thinking, but that doesn't look like left. Okay, so it is the left eye, and it's going to diagonal. There's an optic chiasm. It's going to cross over to the right side occipital region. You're going to learn when we do nervous system that the occipital region of the brain is going to interpret what you see. All right, so that's that. That's all about the sphenoid. We talked about the ethmoid and crista galli, the ridge. Okay, so don't forget that. I'm just reviewing now. And the cribriform plate, I'm going over the list. Perpendicular plate, okay, that's still part of the ethmoid bone, just so you know. If you want to know everything back here, that's the ethmoid bone. You know, the perpendicular plate is still part of the ethmoid bone. So are the concha. All right, finishing up the handout. I just want to make sure everything's covered. We talked about the lacrimal bone. We talked about the vomer, which is the bottom portion. It looks like a ski slope. So the top portion is called the perpendicular, and as you slope downwards, straight down here, it's called the vomer. Flip it upside down. You could also see it in the skull, inferior aspect of the skull right there. Okay, other than that, I'm going to move away from the skull, and we're going to start up with the mandible. Still part of the skull, but I'm going to finish up with the mandible. All right, so the mandible, there it is. What do you need to know? Well, it has your lower teeth, and there are these two little tiny holes here. I don't know if you can see that one here, and we have a sticker covering the other one, but there it is. Okay, so let me shine the light on it so you can see a little bit better. There it is. So mental foramen, that's what it's called, mental foramen. So again, all these foramens have neurovasculature moving through. So most likely, most of the time, it's nerves. Now, in looking at the mandible, this whole section here is called the ramus. The rest of it is called the body. And if you look at this section anteriorly, that's called the coronoid process. Coronoid process. And this one is going to attach, and it's part of the temporomandibular joint. So this is the condylar process. Okay? So coronoid is anterior. Condylar process is posterior. Most likely not that important to know, but you should still know what these names are. I doubt that we're going to ask you such extreme detail that you need to know every minor detail of the mandible. But I'm still going to be very comprehensive and make sure that you know everything. Like there's an alveolar process, you got the lower teeth. So, you know, technically I would think that you probably might get asked about the mental foramen, the ramus. You could definitely be asked, possibly, of other things like the body ramus, and of course you've got the coronoid versus the condylar. So I think it's more of a confusion between the two C's. So kind of just try to remember the difference between the two. So in the front is condylar, and in the back, posterior, is, no, I'm sorry, it's the other way around. In the back, it's condylar, and in the front, anteriorly, is coronoid. Okay? All right, so that's that. I'm done with the skull. Whew. Luckily, I didn't go over the foramens. The only one that I'm going to actually highlight is the foramen magnum. Could you possibly be asked about other foramen? I don't know. We could possibly have more questions on foramen. So let me do a brief review on that, and then we'll finally say goodbye to the skull. So definitely, for sure, there should be no ifs, ands, or buts about learning the main ones. So you learn the main foramens. Like, for example, you learned the optic canal, you learned about the mental foramen, foramen magnum. So foramen magnum, yes, you have to know. I mean, it's just so obvious. It's easy for you. This would be a gift to be asked about this. The spinal cord runs through it. Okay. Now, you also, if you recall, learned about the mastoid process and the styloid process. So take a look right here. Notice in between the styloid and the mastoid is a foramen. That foramen is called the stylomastoid foramen. How appropriate. So here it is. stylomastoid, where my finger is, the stylomastoid foramen right there. Okay? It's in between the styloid process and the mastoid process. Right there is the stylomastoid foramen. Now, if you look at it, just anterior and medial is a really large section. That is a very large foramen. It almost looks oval shaped, almost like it has two holes. That's the jugular foramen. And then just anterior to that is the carotid canal. So these three hang out together. The first one, where my finger is on the right here, stylomastoid foramen, jugular foramen, and anterior to the jugular right there is the carotid canal. So those three always hang out together. So I hope that helps. So again, styloid process right here, mastoid process right there. There is your stylomastoid foramen. Right here, very large, almost looks like two foramens. That's the jugular foramen. Just anterior to it, where my finger is right now, right there, that's the carotid canal. Now, take a look, and you can see we talked about the vomer. There's two really big holes there. You can see that. That's called foramen lacerum. So they're on both sides, foramen lacerum. Let me point my light on it. One is right there, and the other one's right there. Now, if we look real close, I'm going to stand up and take a look. Next to it, adjacent to it, okay, right here. Let me bring it closer. So there's your foramen lacerum. Right there, lateral to it, I've got my light right on it. Okay, right there. You see it? So there's the lacerum, and anterior and lateral to it, where this finger is right there, showing you, that is called foramen spinosum. So foramen lacerum, foramen spinosum, and then just posterior to it, really tiny, 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 foramen lacerum, foramen ovale, foramen spinosum. So how do you remember this? L-O-S, loss. Okay, so the two foramen lacerum are right here. Then if you look at this one, it's larger and it looks oval shaped. So that's foramen ovale. And the really small one right here where my finger is, okay, and it's posterior to the ovale, that is spinosum. So lacerum, ovale, and it's very oval shaped. And then if you look even closer, there it is, tiny, tiny posterior, that is spinosum. So foramen ovale, let's see if I can shine the light on it. Foramen ovale is right there. Foramen lacerum, foramen ovale, and then right back here, foramen spinosum. So L-O-S. Let's do it on this side so you get practice. L, foramen lacerum, and then, hold on, I can't see. And then right there is ovale, and then right behind is spinosum. So lacerum, ovale, and then back there is spinosum. Okay? So all in all, those 6 are quite a lot of detail. Make sure you know the ones on your handout. The ones on your handout are mental foramen, optic canal, foramen magnum. I did not see the superior orbital fissure and inferior orbital fissure, but I'm telling you, you need to know it. And that's right here, the sphenoid bone. Mental foramen, and that's pretty much it. Now, these other 6 that I just showed you, what are they? The 3 that hang out together. Okay, so what are the 3? The stylomastoid process right there, okay? The jugular foramen and the carotid canal. All that is lateral to foramen magnum. Then over here, if you take a look, you've got the lacerum together as a pair. You've got the ovale as a pair, and it's pretty large, the ovale. You can't miss it. All right, and then back here, right behind the ovale, posterior and lateral is spinosum. Whew, that is it, finally. I think I've gotten everything, and I always keep coming back. So here I go one more time because I don't have everything. Last but not least, I did not go over the roof of your mouth. And that is on the second page. If I look over here, I believe it's on the second page. The Palatine Bone. Yes, it's on the second page of your handout. So Palatine Bone is right here, and then back here, it's kind of got like a little U shape. This whole area here is the Palatine process, Palatine Bone. All right, so I can't think of anything else. I hope this is a good review of the skull. I went over everything, and then some. So I'm going to move on now to finishing off the axial skeleton. So let's go over the atlas, axis, and all the different vertebrae. So I'm going to pull them all out now. Give me 1 second. Here we go. So the first one I'm going to mention is the atlas, also known as C1. It is basically this little thing here holds your entire skull and your over 4-pound brain. So that's pretty phenomenal. So it just shows how fragile we are. So these are the condylar occipital condyle of the skull, which you can see right here. Okay, where am I? Let me make sure I have it good here. I want to make sure you can see it right here. Okay, so these sections right there are the condylar occipital condyles, and it articulates right here. Okay, so it's like a bowl that matches. All right, this is the posterior portion, and that's the anterior portion. The transverse processes, and you can see the spinal nerves come out of there. All right, the one thing that will set it apart from all the other vertebrae is that it doesn't have a spinous process. And it kind of looks like if you looked at the jaws when they catch a shark and they open it up the mouth, that's what it looks like. Now, the second cervical is also special, and that one is called the axis. So why is it special? Because it has this structure called the dens, and it sticks up. Do you see that? So it's called the axis because it helps turn your head. So now I'm going to put these guys together like so. All right, so I don't know if you can see, but this is what it looks like. I'm going to turn it around. And so now your head, your whole skull, and your atlas can turn on this axis. So C2 is very easy to identify because of the dens. And that's the only, out of all the vertebrae, this is the only one that has this structure called the dens. Now we start seeing a spinous process, starting at C2. There are 7 cervical. Breakfast at 7 cervical. Lunch at 12 thoracic vertebrae. We're going to go over that. Dinner at 5 lumbar. And then 4 to 5 snacks till midnight. That would be 4 to 5 fused sacral bones. And then 3 to 4 fused coccyx bone, which is your tailbone. All right, now going back to the cervicals, there are 7. And the posterior aspect has a spine. And C2 to C7 kind of looks like a fishtail. Do you see that? So it's bipedal fishtail. And you're going to see that C2 to C7. All right, so if I ask you what level vertebra it is, you need to take a look at the characteristics. Does it have a spine? If it does, then it's probably either cervical, thoracic, or lumbar. However, the one cervical that does not have a spine looks like jaws, right? So that's your atlas. But axis, you start to have a spine, and it's bipedal. The only spine that's bipedal is C2 to C7. You're going to see now thoracic does not look like this at all. All right, and C2 is the only one that has the dens. The rest of the cervicals do not have any of that, but you'll start to see a more prominent spine, the bipedal spine, for C3, C4, C5, C6, C7. Okay, so that's C1, C2. Now I'm going to skip over to the thoracic. How many thoracic do we have? We have 12 thoracic. So let's go over the thoracic. What animal do you see here? Some people will say it looks like a giraffe. Some people say it looks like an elephant. I see a giraffe. So Basically, it's quite easy to identify a thoracic. Why? Because it has a long, pointy spine. Do you see that? And then these superior articular facets basically articulate with the vertebra above it. So if it's a thoracic, it's going to articulate with another thoracic. And the transverse processes, the wings, so to speak, whoops, dropped one. The wings are called the transverse processes, and they articulate with the ribs. Okay? The body is pretty prominent, but not as prominent as the lumbar. The lumbar vertebrae you're going to see in a minute. Okay, so that's thoracic. Now here I go. I'm going to show you. I don't even know what I dropped. This video is becoming interesting. We're going to move on now to the lumbar. How many lumbar do we have? 5. Here I go. What animal do you see here? Some people say if you look at it in profile, it looks like a reindeer or a moose. I see a moose. What's the difference? First of all, the spinous process on the thoracic is very long. Here, it's curved and not as long, and it's thicker. So that spinous process represents a lumbar vertebra, okay? You also can see very prominent body. Look how thick it is compared to the thoracic. Look how thick. And that's because it has to hold a lot more weight than the thoracic. And it's, you know, the thoracic T1 to T12, the transverse processes all articulate with the ribs. So they're very wide, as you can see. All right? If you look at the transverse processes here, they're not as long. Also, the articular facets are facing each other. Take a look. They face each other, whereas here, the antlers of your giraffe, they face straight forward, almost like Shrek ears. See that? Looks like Shrek ears. Whereas here, they face each other. Okay? So that's the lumbar. All right. What else? I am going to skip over the sacrum. I'll show it in another video when we do the hip. The next thing I'm going to show you are the ribs, which is exactly what I think I dropped. Oh, nope. I do have a sacrum. All right, I hope this video is entertaining, but it lost its tail. The coccyx bone is gone. So I'm going to show you the sacrum. It kind of, to me, looks like a cobra. See that? So this is the anterior portion. That's the posterior portion. Posterior portion is convex, and the anterior is a little bit curved, concave.